This is a reading from the Holy Shroud and the Visions of Maria Valtorta. This is the resurrection of Jesus. And in the end of the Sabbath, when it began to dawn towards the first day of the week, came Mary Magdalene and the other Mary to see the sepulchre. And behold, there was a great earthquake, for an angel of the Lord descended from heaven, and coming, rolled back the stone and sat upon it. And his countenance was as lightning, and his raiment as snow. And for fear of him the guards were struck with terror, and became as dead men. And the angel, answering, said to the women, Fear not, for I know what you seek, Jesus who was crucified. He is not here, for he is risen, as he said. Come and see the place where the Lord was laid. And going quickly, tell his disciples that he is risen. And behold, he will go before you into Galilee. There you shall see him. Lo, I have foretold it to you. Matthew chapter 28, verses 1 through 7. The resurrection. The resurrection is the most amazing, most important event of Christianity. Paul the Apostle clearly says that had Jesus not risen, our faith would be in vain. What does the shroud say to confirm Christ's resurrection? It straightforwardly says that the body came out of it without ruining the many bloody imprints, which are perfectly intact, complete, and show the familiar aspect of normal coagulation. Barbet, the French surgeon, reports that his old friend Hovelac, anatomy professor at the Faculty of Paris, when he carefully weighed up these facets of the shroud, exclaimed, "Well then, my dear, Jesus Christ is risen." This is borne out by modern medical science. In the shroud's imprints, there are no signs of further cadaverous alterations. This shows that the body was enclosed in that cloth for a short time. The evangelists do not say anything, of course, about the moment in which Jesus' body went from death to life. None of them was present. The first to enter the sepulchre after the resurrection was Peter and John, who ascertained with their own eyes their master's disappearance. What did they see? Exegetes rack their brains when they seek to find out from St. John's Gospel. And when John stooped down, he saw the linen cloths lying, but he did not go in. Then came Simon Peter, following him, and went into the sepulchre, and saw the linen cloths lying on the ground, and the napkin that had been wrapped about his head, not lying with the linen cloths, but apart, wrapped up into one place. Then that other disciple also went in, who came first to the sepulchre, and he saw and believed. Some modern scholars translate St. John's passage with an altogether different meaning. John followed Peter and saw the linens lying, and the sudarium that was on Jesus' head was not lying like the cloth, but on the contrary, rolled up in its place. In other words, Peter and John would have seen all the cloths in place on the stone, with the big difference that the shroud, with the strips over it, would have been limp, no longer containing the body that gave it shape. The chin strap, however, having been twisted, would have retained its shape, as if it still contained Jesus' head. Personally, I do not accept this interpretation, but I leave the solution of this difficult problem to the experts, hoping they might at least agree on the meaning of the words sudarium and shroud. As it is, some think that as far as Jesus' burial was concerned, both words meant the same thing. Others maintain that they were two different cloths. I would like to point out that John the Evangelist also says that Mary of Magdala stood outside the sepulchre weeping. Now, as she was weeping, she stooped down and looked into the sepulchre, and she saw two angels in white, sitting, one at the head and one at the feet, where the body of Jesus had been laid. This suggests that on the unction stone there was nothing. According to Maria Valtorta, it would have happened like this. On the morning of the resurrection, Peter and John went to the sepulchre. John got there first. Afraid and grieved, he kneels at the open entrance to both venerate and gather a few signs from what he sees. However, he can see nothing but the strips put on the ground, in a heap on the ground. However, he can see nothing but the strips put on the shroud in a heap on the ground. This is the first shroud, the soiled one, used to take Jesus down from the cross and carry him to the sepulchre. Peter, arriving out of breath from having run hard, enters the sepulchre, but can hardly see and must do his best with his hands. He touches, shuddering, the unction table and feels it is empty. Now John comes in, and Peter discovers the sudarium in a corner, well folded, and within it the shroud rolled up carefully. This was the clean shroud in which Jesus' body had been wrapped up. Immediately after Jesus' resurrection, the sudarium and linen cloths and shroud burst apart. The sudarium and linen cloths fall to the ground, and the shroud slides onto the unction stone and stays there, hanging over the edge like a flabby, dead shell. At once everything must have been put in order, but who could have done so? Clearly it must have been either angels or Jesus himself. After all, after his resurrection, he ate with his disciples and prepared them a good lunch, bread and roasted fish, on the shore of the Sea of Galilee. Jesus is the Christ, the Son of the living God. See Matthew chapter 16, verse 16. He is the revealer of the invisible God, the firstborn of every creature. Colossians chapter 1, verse 15. He is the foundation of everything. Colossians chapter 1, verse 12. He is the master of mankind and the Redeemer. He was born, died, and rose for us. He is the center of history and of the world. He is the one who knows us and loves us. He is the companion and friend of our life. He is the man of sorrows and man of hope. He is the one who shall come and shall one day be our judge, and, as we hope, the eternal fullness of our existence, our happiness. He is the light. He is the truth. In fact, he is the way, the truth, the life. John chapter 14, verse 6. Paul VI, Manila, November 29th, 1970. The face and wounds of the man of the shroud. The face and wounds of the man of the shroud in Maria Valtorta's narrative. All syndenologists bear witness that the face of the man of the shroud of Turin exudes a really superhuman majesty. It is the face of Christ, notably changed by the ill treatment in Pilate's praetorium and on the way to Calvary. Pius XI stated, "This photograph is worth more than any study. No artist has ever managed to capture the sense of extraordinary peace, gentle serenity, and nobleness revealed in it. The face of the shroud, in Dr. Barbet's words, grazes a little everywhere, especially on the right side, which is also disfigured, as if underneath the bleeding grazes there were hematomas. Nevertheless," Gedda says, "if we make suitable use of the left side, which is intact, that is, if we reverse it and superimpose it on the right, we can reconstruct the normal face. Hence, studying the shroud's face with the method we have designed enables us to reconstruct with great likelihood the face of our Lord Jesus Christ at the age of 33 years. Maria Valtorta's account of the Passion frequently points out what caused the man of the shroud's main traumatic marks. In an overall view, I will list the most visible lesions arising from contusive injuries which the experts have found, and underneath I will quote Valtorta's words. 1. Tumefaction of the middle right of the face, of the upper central part of the forehead, and of the two arches of the eyebrows. On the way to Calvary, and then suddenly the pain of the third complete fall, and this time he does not just trip, he falls from sudden lack of strength, from syncope. He falls flat on his face, hitting his face on the disjointed stones, and lies in the dust under the cross that swivels on his back. 2. Tumefaction of the right cheek, wounded mouth. In Pilate's praetorium, after the scourging, "Come on, hurry, are you worn out? Here's some strength," another soldier says, laughing sarcastically. With the shaft of his halberd, he beats him in the face and hits him between the right cheekbone and the nose, that starts bleeding. Jesus opens his eyes and turns them, clouded eyes. Before starting on the way of sorrow, "May God bless you for this relief," Jesus says to a soldier who gave him to drink. He still has a smile, a heart-rending smile, with his swollen, wounded mouth that moves with difficulty, also because the large contusion due to the beating he received in the courtyard after the scourging is swelling greatly between the nose and the right cheekbone. On the cross, Jesus, who avidly sucked the tart, bitter drink, twists his head, embittered as he is, out of disgust for it. It must, after all, be like a corrosive on his wounded, cracked lips. 3. Excoriations of various sizes at the apex of the nose, slightly deformed by swelling, right eye almost shut. On the cross, his face already looks like what we can see on the photographs of the shroud, with his nose deformed by swelling on one side, the right eye being almost shut on account of the swelling on that side, also increases the resemblance. The mouth, though, is open, with its wound on the upper lip now reduced to a scab. Mouth slightly twisted to the right. On the cross, a dreadful convulsion contracts all the face muscles into one spasm, emphasizing the mouth's twist to the right. It causes the eyelids to open wide, and the eyeballs can be seen to roll underneath them, and the sclera appears. In the sepulchre, then Mary turns to Jesus' head and straightens it as it was bent slightly back and much to the right. She tries to close the eyelids that stubbornly remain half open, and the mouth that remained open, contracted, somewhat twisted to the right. She arranges his hair. Just yesterday they were so beautiful and tidy, but now are a tangled mass, heavy with blood. She unravels the longest locks, smooths them on her fingers, rolls them up to give them back the shape of her Jesus' soft hair, so delicate and curly. Blood and saliva discharge from the right side of the mouth. On the cross, the breathing is more and more like panting, but interrupted. It is already more like syncopated death rattles than breathing. Every now and then a laborious cough brings a light pink foam to the lips, and the breathing intervals become longer and longer. 6. Imprints of the scourging wounds. Vertical blood trickles on the back, hematomas on the knees, more severe on the right knee. On the way to Calvary, he comes against a protruding stone and falls on his right knee. He trips again and falls on both knees, re-injuring the wounded spots. Just before the crucifixion, onto the linen, till then wet only with tears, the first blood drops fall, since many of the wounds, hardly clot-covered, have reopened due to Jesus' bending down to take off his sandals and put down his clothes, and blood starts flowing out again. Now Jesus turns towards the crowd. It can be seen that his chest, arms, and legs have all been hit by the whips. On a level with the liver, there is a huge bruise, and under the left costal arch, there are 7 clear-cut, embossed lines ending with 7 small bleeding lacerations in the middle of a violet circle. A fierce whip sting in that highly sensitive area of the midriff. The knees, contused from the numerous falls, beginning right after his capture and ending on Calvary, are black with hematomas and open on the kneecap, especially the right knee, in a large, bleeding laceration. 7. The wound in the side. Judica Cordelia, as he listed the causes of Jesus' death, wrote, Jesus was in a state of profound anemization, resulting from the profuse hemorrhages that took place before and during the crucifixion. Also, due to great losses of fluids, unreplaced transudation of serum or plasma from the lesions, edematous infiltration of the contused tissues, increased evaporation from exposure to the sun, etc., the density of his remaining blood must have been notably increased, syrupy or pitchy thickening of the blood. According to Dr. Hynek, what came out of Jesus' pierced chest was an after-death flow of thick, dark blood, of which some oozed out by itself, and some was mixed with water. Maria Valtorta seems to confirm this scientific finding. Longinus stands in front of the crucified one, carefully takes aim, and thrusts. The broad lance goes in deep, upwards from right to left. Much water and hardly a trickle of blood already tending to clot ooze from the wound. I said ooze. It comes out, but in a trickle from the plain cut that remains still, whereas Had there been some breathing, it would have opened and closed due to the thoracic abdominal movements. 8. Hand wounds, one arm shorter than the other. Syndenologists have noticed that the man of the shroud has one arm shorter than the other by about 4 centimeters, 1.6 inches. Professor Lorenzo Ferri, after consulting famous doctors, came to think that Jesus must have undergone an intentional dislocation when he was crucified. Maria Valtorta had described this dislocation 4 years earlier. The right hand has been nailed. They turn to the left hand. The hole, pre-made in the cross, does not correspond to the carpus. They take a rope, tie the left wrist, and pull until they dislocate the articulation and tear tendons and muscles, as well as lacerate the skin already slashed by the ropes used when he was captured. The other hand must also be suffering, since it is stretched indirectly, and the hole is enlarged around its nail. Now the hole barely reaches to the beginning of the metacarpus near the wrist. They give up and nail where they can, namely between the base of the thumb and other fingers, just in the middle of the metacarpus. I'm going to stop there.